ahead of an extremely hot weekend, most of Rhode Island is now encouraged to wear a mask indoors in public settings.
The Department of Health told us yesterday the COVID-19 levels in 4 out of 5 Rhode Island counties are now designated at high risk. 12 News reporter Alexandra Leslie spoke with Dr. Philip Chan at the DOH about what's now being recommended. Alex?
Kim and Brian, the health department data shows that Rhode Island COVID cases have been rising steadily for 4 weeks and hospitalizations have been increasing for 7 straight weeks. Health officials are now recommending, if you don't already, to have a supply of high quality masks on hand.
It's not unexpected. We've known that we've been approaching this.
Despite the rise in COVID-19 cases and COVID hospitalizations, the Rhode Island Department of Health says the numbers are still considerably lower than they have been at points prior in the pandemic.
So we're in a much better place. We have adequate treatments. We have good vaccine supplies. COVID is now a treatable and preventable disease. We're in a great place.
Dr. Philip Chan tells me the department expects cases will level off and decrease in the coming weeks. However, that doesn't mean people shouldn't still be taking precautions.
So at this time, we are aligned with the CDC guidance and certainly agree with it, that when community levels are high, like they are now, is that people should mask when they're indoors, but we're not going to be mandating it.
Instead, it is still a personal choice to mask up. The health department is also reminding people about other tools to protect against COVID, including vaccination, ventilation, screening for symptoms, testing, isolating when sick, and asking your healthcare provider about treatment if you test positive.
I would suggest if you're in crowded settings in general, and certainly if you're immunocompromised or have a weakened immune system, you may want a mask as well.
So I also asked about flu season, and Dr. Chan tells me Rhode Island is still seeing flu circulate, but at low levels. Data from the Department of Health shows almost 500 Rhode Islanders have tested positive for flu since last October.
Now, there's something else obviously we're tracking right now. The news about a case of monkeypox being detected in a Massachusetts man. What is the health department saying about that risk in Rhode Island right now?
So it's important to know that monkeypox is a very rare disease that comes from Africa. It's typically involving exposure to monkeys and rodents, and in that part of the world. Now, cases in Europe, they are under investigation right now, but the health department says there is not a concern for the general public here at this point.
Some good news with that, at least.
Yes.
All right, Alexandra Leslie, thanks to you today.